All right. I'm not seeing any right now. Thank you very much for your testimony. Patrick McClellan. Welcome to the committee.
Thank you. My name is Patrick McClellan. I have muscular dystrophy, mitochondrial myopathy, which is a rare genetic muscle disorder. I suffer from severe muscle spasms, peripheral neuropathy, and then also chronic pain. I also wear leg braces on both of my legs that help me walk. I lost my career, became totally disabled about 3 years ago, and I found that eating and vaporizing cannabis has a remarkable effect on reducing my muscle spasms and pain. I'm treated at Gillette Specialty Healthcare, and my doctors are aware of my use of cannabis and have told me that other patients have also reported the same result. I currently take 26 medications or 26 pills every day, a mixture of muscle relaxants, anti-seizure drugs, neuropathic painkillers, and along with high-dose vitamin therapy. One of the medications that I take is Dimox, the glaucoma drug, which I have just learned today damages my kidneys. One of the most intense and painful symptoms of my disease are the severe muscle spasms. We've all had a Charlie horse before. When my spasms occur, for example, in the calf muscle, the Charlie horse starts, then the muscles in the shin, the Charlie horse pulls the foot down, the muscles in the shin spasm trying to pull against it to pull the foot up, then tendons underneath my knee and my thighs will go, my abdominal muscles will go, and then will create a giant Charlie horse through my entire body. During an attack, I am unable to walk, eat, use the bathroom, dial 911. Prior to an attack, I do have warning signs. The muscles will begin to twitch, and that will let me know that something is about to happen. During the winter of 2010, I had an attack that was so severe I was trapped between my bed and the wall for 2.5 hours waiting for my wife to come home. I thought I was going to die. I kept thinking of my wife coming home and finding me dead on the floor. Sorry. Yeah, I'll never forget that the 2.5 hours, and I will do anything to prevent that from happening again. I was not originally convinced that cannabis could help my symptoms. I was a recreational user in my 20s, and I quit because I didn't like the high. But in 2010, after I had that attack, I had remembered that my uncle, who had multiple sclerosis, had used cannabis to help treat his muscle spasms. And then in talking to some friends of mine, they had suggested that I give it a try. So over a 6-month period, I did my own experiment. I currently wear 2 medications around my neck, which are emergency medications that I use when I'm about to have a severe attack. I alternated, when I got the warning signs, between using the medications I wear around my neck and vaporizing a very small amount of cannabis. The medications that I wear around my neck worked 70% of the time, when vaporizing a very small amount of cannabis worked 100% of the time. The Food and Drug Administration have warned that one of the medications that I wear around my neck, by using it the way I do, which is putting it in my mouth and chewing it up, could be fatal. Along with the other medication that I wear around my neck, which is Xanax, which is highly addictive. Now I only use those 2 medications, chewing up the quinine and the Xanax together. I only use that when I'm about to have an attack outside my home, but if I am in my home, I will vaporize a small amount of marijuana, and if I do that, it will stop the attack immediately. I'm 47 years old, and I will do anything to help treat my disease, and I don't want to move out of this state, and I also don't want to be treated as a criminal for attempting to help treat my symptoms. Thank you very much for hearing me speak. Does anyone have any questions?
Yes, thank you very much. I'm not seeing any questions, so thank you very much for your testimony.
Great.
Representative Molina.
Well, Madam Chair, I just thought maybe Mr. McClellan, since he uses a vaporizer, now would be a good time to maybe explain how that works. I know that there's maybe some questions or confusion regarding that, and of course the doctor spoke about that as well, and I don't know if he'd be comfortable explaining how a vaporizer works, just so the committee understands what that means.
Sure, please.
With the vaporizer, I take the marijuana and the dried plant material and then grind it up. And then the vaporizer is a heating apparatus that I will put a small amount of cannabis in, attach it into the heating apparatus that will heat it to about 375 degrees. It does not produce any combustion. The oils within the cannabis and the moisture in the cannabis produces the vapor, which is then drawn into the lungs, held for a few seconds, and then released. But you are not ingesting the burning plant matter. And my physicians at Gillette completely support my use of the vaporizer to treat my symptoms.
Okay, so Mr. McClellan, we just had a hearing recently on e-cigarettes, and I assume that that's the same device as what you're describing, or is it a different kind of device?
I have no experience with the e-cigarette machine.
Okay.
But the benefits of it, at least for me, and this works for me, that doesn't mean that it will work for somebody else. Maybe for somebody else, I did actually try consuming a brownie, but the problem with it, when I have an attack, the timing for it to get through my system, it needs to be right away. The medications I wear around my neck can stop a spasm. If it's going to work, will work in about 5 minutes. The vaporizer will work in about 2 minutes.
Okay. All right. Thank you very much. Any questions from that, members? Okay. Not seeing any. Thank you very much.
Thank you.
Maria Boddicker.